All right. So now we've talked about the motions of the hand, wrist, and elbow. Now we're going to talk about what that translates to with injuries. So, what happens often to this hand, wrist, and elbow? Well, one of the reasons why we're doing it all together is because they're really interconnected. The majority of the muscles, remember, are intrinsic and extrinsic. So, the majority of the muscles are extrinsic, coming from the hand, and they attach either on the radius of the ulna somewhere or they're at the lateral or medial epicondyle. And so are those pronators and supinators. So, the movement of our forearm and our hand, our flexion of our fingers, extension, wrist flexion, extension, and then at our elbow, we're pronating supination with that terminal pronation and supination coming from our wrist. So all of these injuries that happen are generally going to be chronic in nature because of the overuse and the tension put on these injuries. So just functionally, we use the upper extremity to do ADLs, activities of daily living, which I mean like brushing our teeth, holding anything, opening a cabinet, brushing our hair, like turning on a faucet, all of these things. So everything that we do on top of activities of daily living will then make it overuse or repetitive. So if we're doing a certain task that we haven't been doing in a while, then that's going to create a lot of tension. So we're in the lower extremity, you often have imbalances of like one muscle might be tight. So now the other side of that contrary muscle is then going to have an issue because it's overloaded. Well, in the wrist, that can happen very much in the wrist and the elbow, but often it's just from repetitive use, overuse of that area. So like the tendons where they attach the epicondyles breaking down over time and becoming really inflamed because of overuse of using those flexors. So like in tennis, any kind of sport, a lot of racket sports will have injuries with the elbow because you're grasping, you're using the grip strength of the flexors, but then you're also doing a lot of eccentric contraction of the extensors to really cock up and generate torque and force. So we often see that too. And then from another perspective of acute injuries, we do see acute traumatic injuries that result in compression type mechanisms of injuries. And that is typically from FOOSH, FOOSH, fall on outstretched hand. And those are going to result in injuries when we land and we catch ourselves, the force is going to go up the kinetic chain. So in adults, generally speaking, our bones are really healthy, especially like young, middle-aged adults if we don't have any underlying conditions. So our bones will overpower our ligaments, and often our muscles, our soft tissue, our ligaments, tendons will be the ones to rupture or have an injury to them. So that would look like a TFCC sprain, which is a ligament I haven't talked about, but it's a ligament that attaches the radius to the ulna to the carpals and stabilizes the wrist, especially in that terminal pronation, supination type of thing. Also, our elbow or UCL will be the first to go on the medial side. And then moving up, this is shoulder dislocation and elbow dislocation are the things that we often see. Where in children, the bones are going to be weaker because they're malleable, they're soft, they're still growing, they have open growth plates, and the soft tissue is actually going to stabilize better. So we'll see fractures. So we'll often see distal radius fractures, especially if their growth plates are open, which is this line right here. If it's open, you'll really see the pain really on the distal end of there. It could be the growth plate, it could be just the normal bone, the regular bone. And then we'll often see radial head fractures. We'll see really what's really common is supracondylar fractures. So right above the epicondyle, we have this supracondylar. So it's above the condyles. So right here is the weakest spot, and that's often where we'll see a break. So if a child falls and they all of a sudden report wrist pain at the base of their thumb or elbow pain, they need to go get an x-ray by someone who knows how to read a pediatric x-ray, because this fracture won't show up. In fact, it'll just have these big bubbles of shadows next to it, which is called fat pad sign. So just an FYI, because I see that a lot. And so that's something to understand about the types of injuries. So you will see anomalies to that, like the OCD, which you'll see in the key light spotlight, which is from the radiocapitellar joint of compression overuse, but it resulting in a bone injury, and it's a cartilage injury. So more in there. So pathomechanics in general with the hand, wrist, and forearm, we're going to see a lot of overuse injuries right around the elbow, sometimes at the wrist, just because most of the muscles extrinsically that attach to the hand and move the hand and wrist are going to attach somewhere around the elbow and cause a lot of pain. And we're already doing so much with ADLs that when we add some kind of repetitive task, we're often going to see that. So an intervention for most of these are going to be activity modification and decreasing that load on the area, and then getting the inflammation under control, strengthening that area, and then adding that activity back on. If you have any questions about the pathomechanics of wrist, and as you move through into the key injury spotlights, reach out.